Hi, Sergio. Good evening.
Miss Encinas, good evening. Sorry.
First. Okay. Sergio. Oh, we have just a few minutes, but
Yes, I'm
let's.
so sorry. I got here like running to the hotel.
I'm pretty sure of that. I was the same. Okay. Um, how can you explain to a patient about endoscopy, the procedure?
Endoscopy. Um, well, like in a simple way for a patient, I would explain to him or her that it's a procedure or a that involves a not a machine but a device that helps the patient and also the doctor to explore the the esophagus, the stomach, and to see if there's any lesion in there, or if there's reflux, or if there's gastritis. Uh, it helps to see if there's, for example, a tumor in there, or see if there's an ulcer also. So it basically helps the doctor to diagnose uh, some alteration or a disease that the patient is having like at the moment, because maybe she or he is having some symptoms that is not causing the patient to live a healthy life. So that would be like a simple way to explain the patient.
Okay. Okay, that's good. This is called lay terms. Okay, to make it easier to the patient. Lay terms. Well, can you explain the taking blood procedure?
That taking blood.
Yes, I
Oh,
know it's not your area, but you can explain.
yeah. Well, what I remember, like to the patient, I will tell him or her that we have to perhaps take a blood sample so that we can make a blood count. The sample we will take is through a, I don't remember if it's the correct term, a veno puncture, I guess,
Yes,
or
yes,
or
yes, that's
uh,
good.
they well, this will be the venopuncture will be located in the anterior side of the elbow. So once the nurse localizes this area, uh, the patient or him or her will feel the needle getting inside. It will cause a little pain, but it will be just for a short time. So I would tell the patient like to just hold down for a few minutes and take a deep breath to take the blood sample, and that will be so helpful for us to have a more clear idea of how her or his analysis uh, in blood is, like to give us a broad view of how the patient is.
Okay, okay, that's good, Sergio. We don't have so much time. Okay, but I want to ask you if you want to change the schedule later. I don't have any other schedule than 10:30. I don't know if
But
it's better for you.
like starting the class at 10:30.
Yes,
So,
attending the class that time. Because I think you are running out like me to have this time, but we just have a few minutes, and I don't think we are making good in this time. The conversation should be better if we have the so I don't know if you want to change the schedule later or if it's trouble for you.
um, it's because
What is
10:30
better
is,
for you? I don't know. It's just because it's so late for you.
yeah, it's too late and I have classes all day, so I'm like very, very tired. But mm, like starting, it would be like maybe easier if it's 10 o'clock. I wouldn't have any problem if it's at 10.
The matter with that is that Carla Calle is at 10. I can talk with her to change
Please,
the schedule and maybe she can change with you. Okay?
please, because I really don't have any problem if it's like at 10, because at 10 on Tuesdays and Thursdays, my class from the other course ends. So I will be free by then.
Okay. Okay. I will let you know then. And please, I will ask you to, I don't know if you can watch my questionnaire
Yes,
to
I
fill
can.
it, please. And I will change it for you because you're running out and it's so
Yeah.
hard. I know it's hard for me too. Okay, thank you. I can see it now. Just one more, please, and I'll let you. Well, but I think we have time until Claudia appears. Mm, maybe you can choose another procedure you want and just describe it a little fast if you want.
Um, all right. Which procedure can it be?
We have not only endoscopy or enteroscopy. I don't know. Oh, well, Sergio, it must be another time. I will let you know about the schedule change. Okay.
Okay, no problem, Mrs. Ina. Thank you so
Okay.
much. And please, if you can talk to her and maybe we can maybe change it. But let me know, please, if
I will.
it's
Okay. Take care. Bye bye. See you tomorrow.
you. Bye.
Bye bye. Hi, Claudia. Good evening. I don't know what time is it there. To you. Cannot listen to you.
Teacher,
Yes. Okay. I can now.
yeah, I'm just telling you if I can participate with the class just by the telephone and not video call. It's okay? Because I'm at the street.
Yes. Yes. It's not a problem. Uh, if you want, I don't know, but if you are having a great time and enjoying with your family or something, I can give you this class for free and maybe have the next time. I don't know if it's okay or you want to take it anyways.
No, I want to take it anyway because you know how are my schedules are. It's
Yes,
complicated
I
for
know.
me.
Okay, let's just talk. It is only 50 minutes. Okay.
Okay.
Can you explain to a patient what an X-ray is and what is a CT scanner? Or what does a CT scanner?
Well, an X-ray, it's a study that you will have radiation, and it's a very basic study. So it's a complement to make a diagnosis. So it depends on the part of the body. It would be radiolucid or radiopath.
Okay.
So it's a complement to make a diagnosis. And also it could be work for give a treatment in patients with cancer with radiotherapy.
Okay. Okay, Claudia. And what does a CT scanner, or what a CT scanner does?
What is a CT? Well, a CT scanner, it's it's a study to more specific diseases and to see more specific, to make a more specific diagnosis. It's a bigger machine, and the good thing is that you will not present radiation like the X-ray. The CT scan also, it's a very short study, and maybe if you have some doubts with the X-ray, you can have more specific diagnosis with the CT scan. It depends on the organ that you want to see.
Okay. Okay, perfect. And Claudia, can you explain a taking blood procedure?
Sorry?
You explain a taking blood procedure?
Okay. Blood procedures, well, principally we have the hematology procedures. It's good to know the specific ranges that you will have, and it depends of the kind of measure that you want to have, like for example millimoles, nanograms, or grams percent. So it depends of what you want. You can evaluate, for example, hematology tests, for example, and see the level of red blood cells, white blood cells, platelets. Also, you can measure the electrolytes like sodium, potassium, or chloro. That's an example.
Okay. And I don't know if you can explain the main differences between the endoscopy and enteroscopy.
Well, endoscopy could be realized through the natural orifices like the mouth or the anus. And you can see the bowel, or also with endoscopy for the mouth, you can see the esophagus, the stomach, and the, I don't remember how to say intestino delgado.
Okay. Large bowels. Or large bowel. Yeah.
Large bowel. Okay. And well, the enteroscopy. Well, I didn't understand very well the enteroscopy because I really didn't understand very well, teacher, because I understand the
Mhm.
endoscopy, the colonoscopy, the fibrobronchoscopy, that is for
Mhm.
the lungs. And I'm not pretty sure because in the image that we have, it presents a long tube that are over the nose, but it would be the same maybe that an endoscopy.
I think the main difference is that in an endoscopy you can get to a not to the bowels. You're in starting by the mouth.
Ah, okay.
Enteroscopy go all over the mouth, esophagus, stomach, bowels, colon and rectum. I think
Ah,
it's the difference, but of course there are other more.
yeah,
Okay.
because usually we use just endoscopy, by the mouth, and the colonoscopy here in Bolivia. Well, in Bolivia.
Okay. We just use endoscopy.
Yeah, for sure. Endoscopy and colonoscopy is very usual.
Colonoscopy. Okay,
And
and
fibrobronchoscopy, but we didn't see that at the.
yes, but it would be good if you can explain the procedure of that. Can you?
Well, the fibrobronchoscopy is also with a tube that it works with a control that you can handle. You can handle with your hand. And the fibrobronchoscopy, well, the first use is to get access to the airway.
Okay.
When you have a difficult airway, yeah, it's most necessary to have a fibrobronchoscopy to see the um, the larynx and
Uh-huh.
introduce the tube in patients that it's difficult to the intubate and have a difficult airway, like burnout patients, for example.
Mhm.
And also, fibrobronchoscopy is very useful for pneumologists and take a little pieces of the lung when you have maybe could have a diagnosis of the cancer.
Mhm.
Also, to open a collapsed part of the lung. So the fibrobronchoscopy is very useful for the pneumologist too.
Yes, I can see that. Okay, Claudia. Okay, that was good. Thank you so much. And thank
Thank
you
you.
for coming.
Yeah, I'm
Guys,
finally getting.
you're having fun. Can you please fill my questionnaire?
Yeah, but I can check because I think I can see just the results of the questionnaire.
Okay, I will.
I I couldn't take an option. Just show me the. Ah, yeah,
Okay,
now.
now? Okay,
Yeah, now yes.
okay. So how is Buenos Aires? Cold?
Today was good. This was a little warm because the other days was so rainy.
Yeah?
And
Oh
yeah,
yeah, I remember you were with your hat and everything.
yeah, but it's pretty cool. Kind of similar to La Paz of the structures of the city, and the food is
Okay.
delicious.
Oh yeah, I think it's the best.
Yeah, the best meat. That's good. That's true.
Hey, Claudia, thank you so much again and have fun. See you
Thank
tomorrow.
you, teacher. See you tomorrow. Bye.
Take care. Bye bye.
Bye.
Hi, Valeria. Good evening.
Hi, good evening. How are you? Hi.
Yeah, thank you. Thank you so much. Okay, Vale. I have a few questions about yesterday's class, please. Mm, can you explain the taking blood procedure?
Sure. You listen. Are you listening me? I have a little bit. You have a little bit of interference, but you listen me well.
Yes,
You can.
I can
Ah,
listen to you. It's just that we have a little delay, but
ah.
let's be patient, okay?
Okay, it's fine. So the procedure for taking blood. So first we need to have a sterile. What is the correct pronunciation?
Sterile.
Sterile needle, alcohol, a gas, and the tubes where we're going to put the blood, and a tourniquet, right? So first we extend the patient arm and locate the vein, right? So a clear vein to be easy for us to do the venipuncture. And so we put the tourniquet 4 or 5 fingers up and tell the patient to make a fist. So then we insert the needle and remove the tourniquet and put the gas with alcohol. Kind of.
Okay. Yes, okay, that's good.
Okay.
Sometimes when we explain to our patients, we use lay terms, okay? It's just an easiest way to explain to our patients. But that was really good, pretty clear.
Thank you.
Okay. And can you explain the differences between endoscopy and enteroscopy?
Endoscopy is a procedure which is allow us to see the inside of the body person, the internal organs. And what was the other one? Did you ask? I'm sorry.
Enteroscopy.
That one, I don't know. What? I don't remember.
Okay.
Enteroscopy.
Okay, we have it both yesterday, but I was just talking with your classmate, and we were saying that the main difference between an endoscopy and an enteroscopy, it's that in an endoscopy we get by the mouth or by the anus, right, or the recto into the body, but an endoscopy and enteroscopy might be by the mouth, and it will take the whole way to the rectus. Okay.
Ah,
Okay. Can you explain what an X-ray is?
X-rays are the most common use to check fractures.
Okay. And how could you explain to your patient? I know you're not a technician or radiologist, but I know that also you know how is the procedure, or maybe you can tell me in general how would it be, because maybe a patient would ask you and you can tell them.
So maybe first you need to take your clothes off, and we're going to give you this. I don't know how to say it. to put como una bata. Bueno, it depends in which parts are we taking the X-rays, right? But put an example that is your feet. So you just need to sit down in the machine and put your feet straight, and this will be very quick. We just need to we just took an image, or like, I don't know, we just maybe we are just going, this will be just a few minutes. We're just looking for the fractured or something like that.
Okay, no, it's okay. It's
Uh-huh.
okay. Just to let your patients know about that
What are
procedure.
we going to do?
Yes. Okay. And can you describe the procedure of a CT scanner?
A CT scanner.
Yes.
A CT scanner is a computerized tomography in which combines the X-rays, images taken. I think that CT is like I forgot the name in Spanish. Is the one when we use contrast or not, right?
Yes.
Yes.
Computerized tomography.
Computerized tomography. So these help us to detect internal injuries, maybe, or bleedings. And it's almost bueno, it depends on which one we're doing, right? If you are going to use contrast or not, because if we're going to use it, we are going to apply I forgot, I forgot the name of the element.
Supply.
El element, no sé si era, no era, wait, I don't remember the elements that you use for the contrast.
The liquid? You mean the liquid? Okay, I don't remember, but I think it's the contrast substance.
Let me.
It might be that. Okay, let's check it once again.
Gadolinio.
Okay, I think we didn't talk about that.
No, I just remember since I think 2 months ago, I took my grandma to take a CT, and so they told her to drink a lot of water, so the liquid for the liquid to get out of the body, because I think it's dangerous. For
yes, if it's so long for so long in the body, right? What is the name?
I just but wait. Wait. It's gadolinio. Gadolinio.
Okay, gasoline.
Gadolinio.
Just to let us know. Okay.
Bueno, that's the one that we use here. I don't know.
I think it's universal. Okay. Do you want to add something else?
No.
Okay. Any other procedure that you know and you want to describe for me, please?
Maybe the endoscopy.
Okay.
That is, the endoscopy is a procedure, like I said before, that allows us to see the inside of the person's body. We insert a tool that is called an endoscopy into the person's body, and most of the endoscopy are thin tubes with powerful light and a little camera that allowed us to see the internal organs.
Okay. Okay. We introduce it by in which size?
It depends which endoscopy are you going to do. Will maybe for it can be in the mouth or the anus or vagina. It depends.
Okay. Okay, that's good. That's good, Vale. I don't know if you want to ask any other thing, or do you want to add something else?
I think just to clarify, I remember yesterday that we saw the radiography and radiology, right?
Radiology and radiographer?
Radiography is the one, is the person who took the radiology, right? Radiology.
Radiology might be the specialty.
Ah,
Radiographer is the technician who takes the radiography. And in radiography, it's the plaque that we took in order to know and diagnose, right?
okay. That I have that a little doubt of it. A little confused, but now it's clear.
Okay, perfect. And I will send to you my questionnaire, please. I will ask you to fill it for me
Okay.
now that we have a few minutes. There you go. Can you see it?
Yes, I already submitted.
Okay, perfect. I will take a picture. Just a minute. Okay. Yes, smile, please. Just kidding. But
Okay. Bye. See
one
you
more, one more,
Okay,
please.
another one.
Just, it has 3 questions. Thank you so much, Vale, and see you tomorrow
Okay,
at
see you. Bye.
8 Bolivian hours. Bye bye.
Yeah,
Take
6
care.
mine, 6 mine. Today I don't get confused, but since here is it's 5. They're 5:28. So 2 hours difference.
Okay, thank you so much. Take care.
Bye.
Have a night and day. Bye bye.
Good night. Bye bye.
Bye bye. Hi, Mateo. Good evening.
Hi, teacher. Good evening.
Okay, can you listen to me?
Yeah.
Perfect. We were having a little delay problem. Okay, Mateo, can you explain to a patient what an X-ray is?
Okay, so an X-ray is it's supporting diagnostic procedure that that we are able to watch the the inner structures of their body. It's more commonly used to observe the structure of bones and some other organs, but it's more frequent for bones and lungs and the heart.
Okay. Okay, perfect. And what a CT scanner does?
A CT scan. A CT scan is the same. Is the same principle as an X-ray, but it gives us more a more detailed image of the inner structures of the body.
Okay. Do you need a contrast substance in this case or no?
Sometimes, if we want to examine the gastrointestinal tube, we should use a contrast compound.
Okay.
Or with cerebral scan or some things like some procedures like that.
Okay, perfect. Mateo, can you explain the taking blood procedure?
The taking blood. Okay. So we have to use I don't remember how is the.
Which one? Describe it.
Yeah, it's a sort of a cloth that we put around the arm, and then we insufflate with the cuff.
The tourniquet?
No.
Another?
You tell me about the blood pressure, the taking blood pressure.
The taking blood procedure with the needle.
Taking blood procedure. I misunderstood totally.
No worries.
So we have to stop the venous circulation with. Sorry. ¿Qué ha pasado? So sorry, teacher. My mom was yelling at me to get the car inside the parking lot. So we have to stop this venous return by applying pressure with a tourniquet in the superior part of the arm, so the veins can be more observable and visible and bigger. And then we need to clean the surface with an antiseptical, and with a syringe of, it depends the size of the syringe. We have to what is the puncture, to make a puncture?
Venipuncture.
Yeah, to fin a puncture in the site we have localized before, so we can access the vein lumen. And when we observe that blood return on the needle, we retire the tourniquet and start pulling the embolus, so we can extract blood from the vein.
Okay, and we have our sample of blood.
Yeah.
Thank you. Thank you, Mateo. And well, we were having a little difficulty with this part. I will tell you now. Which are the differences or the main differences between an endoscopy and an enteroscopy?
Enteroscopy.
Yes.
Well, I think the most large difference is the organ we are observing through endoscopy, because endoscopy we only observe the upper part of the gastrointestinal tube, from the mouth through the second part of the duodenum.
Okay.
And that's pretty much it. And through an enteroscopy, we can see from that part that I mentioned before, the most distal parts of the gastrointestinal duct. I think that's the most large difference. Maybe it's another, but I think there's not. I think that's a pretty much difference. Yeah.
Right. Yes, we were just having trouble trying to get the main difference. And
Okay.
endoscopy,
Uh-huh.
in an endoscopy, you can get into the mouth or into the rectus, right?
No, endoscopy, no.
Okay.
Through the rectus, it depends of the organ you want to watch. Through the rectus, maybe a rectoscopy, if there's only the rectus. If you want to go farther, you have to make a colonoscopy. If you want to go farther, then it's an enteroscopy.
Okay. Okay, perfect. And well, do you know any other procedure, and can you describe it for me, please?
Any other procedure? I think I would talk about tracheostomy. Tracheostomy is a procedure when we have to communicate the lumen of the trachea to the exterior space. Yeah, to the exterior. This is a procedure made when the upper airways of the patient are obstructed or are not easily acceded. Is the access of the upper airways is difficult. So the procedures consist in cutting to like 2 centimeters beyond the cricoid cartilage,
Mhm.
made a cut in the skin and access and dislocate the soft tissue circumdating till we can watch the trachea, and then we cut the trachea to access the airway of the patient, and then a tube is inserted in the trachea and fixed with a balloon, a security balloon, and externally is fixed with some. I think sometimes in the past days they made stitches in the skin, but now they just with a cord they secure this tube to the neck of the patient and with the inner balloon, and that's pretty much it. That allows the lungs to breathe with no necessity of the permeability of the upper airways.
Okay, perfect. In which cases do you use or you make these procedures?
An example would be when there's a car accident, maybe, or for a motorcyclist, and the patient has several face fractures that difficults the access to the upper airway, so the physicians can't intubate regularly and have to make this procedure. Maybe when a patient is in intensive therapy care. I don't remember which were the indications, but it's frequent to make the patient this procedure. I think it's something to be that the patient can be intubated a lot of days because the upper airways can be injured.
Mhm.
So it's better to make a tracheostomy.
Maybe in an allergy condition?
Yeah, maybe in an allergy condition, but that's more for an emergency. It's more like not so procedural. You have to make the incision that way. That at that time, in that time, you can wait to make a tracheostomy, and like the ostomy is the difference. But you have to make a tracheotomy.
Okay, there is a difference. Oh, I
Yeah,
didn't.
it's more like an emergency. You can make a tracheotomy if the person having this anaphylactic shock
Yeah.
is it's about to die in I don't know, in the dining room. You can for emergency you can grab a knife, anything you can, and cut the trachea, and with a pen cap like this you can permeabilize the airway.
Okay. Okay, thank you, Mateo. I didn't know that. I thought it was the same thing, tracheotomy and tracheostomy, right?
Yeah, I thought that as well, but isn't. It is.
Yeah, it's good to know because it happens everywhere all the time, even though if I'm a dentist, I could have the problem, right?
Yeah, it's on drugs.
Yes, please fill my questionnaire for me.
Okay, I did it
Thank you
already.
so much. I will take a picture. Just don't move for a second, please.
Okay.
One more and I'll let you go. And see you tomorrow at 8 p.m.
Okay,
Thank you so much, Mateo. Have a
thank you,
great
teacher.
Take care. Bye bye.
Have a good night. Bye.
Hi, Melanie. Good evening.
Hi, Miss.
How are you? Are you busy? Are you tired? Mhm.
I'm okay.
Okay, that's so good. That's so good. Let's talk about some subjects that we were talking about yesterday, okay? Can you explain as if you explain it to a patient, what is an X-ray?
Okay. The X-ray is a exam that we can maybe compare like an image to see the organ or the tissues internally. In this exam, we use a little of radiation, but it's not dangerous because it's very, very little. And in this kind of exam, the patient is positioned in front of like a big camera, the machine, and the radiologist takes a picture or a photo to see the, for example, problems with the bones, or in the most of the cases, a problem in the lungs, maybe in the pneumothorax or fractures on that this kind of disease internally. No, it's very used for example, in the system, pneumo system, pneumo, all that in this kind of disease, and it's not painful, and include the exam is very cheap in a lot of hospitals, so it's very, very easy to use, very useful.
Okay, perfect. And what a CT scanner does?
The CT scanner,
Yes.
it's similar, but it's more it's better because have a better quality. In the CT scan, the patient is lie in kind of bed, because the patient have to go inside in a big machine. The machine is like a big ring. It's circular and have a lot of noise. In this exam, we use radiation too. It depends of the machine, but the difference is that the image is it's better, because in the CT scan, take a lot of image around the part of the body, and the CT scan put together all these image, and we can see better the part that we have to, that we are interested to study. No?
Okay, perfect. Is it usually used a contrast or not?
Not always, depend of the disease, because in some cases is we have to use it to see in the image more clearly the I don't know, the organ maybe that we have to see better in some cases, but it's important to ask or have a laboratory exam, because if we have a patient that have problem, for example, in the kidneys, is they kind of control maybe can be dangerous in some patient, or maybe are allergic, so we have to be careful with the contrast.
Okay, that's good to know. Okay, Melanie, and can you explain the taking blood procedures?
Oh, okay. And this procedure is very common. A lot of nurses is the most of the person that uh, have this type of procedure. The part of the when we take the blood is on in the level of the elbow, is very used for to see problem in the blood. It's not painful, but we have to be carefully, because maybe if we don't we don't make it very good, we can have or maybe the patient have the hematoma or some little injuries in the place that we put the the I don't remember how to say the jeringa,
The syringe
the syringe. So that we have
or
to
needle in this case. You can use it.
yes.
Okay. Okay, perfect. And just one thing, procedure.
Procedure.
Yes. Okay. Can you explain the main differences between an endoscopy and an enteroscopy?
Endoscopy and endoscopy, they are similar, because we use a flexible tube with a camera. The gastroenterology is that make this kind of procedure. But I think that the most important difference is that one of them, the camera goes or see the stomach and duodenum, but in the enteroscopy we can see the small bowel. And other different, for example, in the endoscopy, this flexible tube start in the mouth, and the enteroscopy can be start or in the mouth or maybe for the anus. And they use to a different disease. In the gastritis is most they use the endoscopy, and for polyps we use the enteroscopy. So depend of the disease in the patient, and not painful so much, but maybe the patient can have some, or maybe the patient have a bother because it's not very comfortable, but it's not painful around in this procedure.
Okay, perfect. Can you explain any other procedure you know or you usually make?
Mm, I have experience with endoscopy, because when I was a child, I throw for this procedure to diagnose the gastritis, for example. And the endoscopy, the patient has to be anesthesiated, well, anestesiado
With anesthesia
with
or
anesthesia.
Mhm.
Yes, with anesthesia, because it's not comfortable. We put a big tube in the mouth and in the throat. It's uncomfortable. I remember that the nurse put a towel or a big gases under the mouth, because the patient have a lot of
Saliva.
saliva, a lot, because all is not controlled by
Mhm.
him or her. No? This flexible tube, in a lot of tubes that I see, they are black and have a different size to go inside. Maybe if it's a child or an adult, they have different of flexible tube, and always have a camera to see in a screen the surface of the esophagus or the stomach. And the specialist has to in some in a lot of cases, I don't know if in all, but in a lot of these procedures have a biopsy to later have it. For example, in my cases, I have when I was child the Helicobacter pylori. So in this patient have to prescribe the antibiotics and all the diet with that, no? Well, I think that is the most important in the endoscopy.
Okay, that's so good. And I'm curious about what you mentioned. The treatment for gastritis is antibiotic and of course a good diet.
Yes,
But
in my cases, the antibiotic is for the Helicobacter pylori. It's not in all the patient, but for this bacteria, yes, we have to use antibiotics.
okay, and how much? I think a week you took the treatment or it's more.
7 or 10 days, I'm not wrong. And we have
Okay.
to use the breath test to see if the patient have the urea that is cases by the bacteria. So
Mhm.
we use these two exams, the endoscopy and the breath test. That is it's better because it's not it's better in no es invasivo. It's not invasive.
It's
Or
not invasive.
it's not invasive. The breath test. Mhm.
Okay. Okay, that's good. That was good, Melanie. Thank you so much. I will send to you my questionnaire, please,
Thank you, Miss.
if you can fill it.
Yes, yes,
Please.
I can see it. Okay.
Okay, I will take a picture as soon as, okay, right now. And one more, please. Okay, Melanie, thank you so much. It was good today.
Thank you, Miss.
Better. I really enjoy talking to you because you make yourself understand very well. Just a little thing with the pronunciation, but I think with the time it will turn to nothing. Okay.
Thank you, Miss. Yes, I will practice more for my pronunciation.
Read out loud a
Okay.
book or maybe sing a song in English. It will help.
Yes. Okay.
Okay.
Thank you so much for the tips. Thank you.
Take care. See you tomorrow then.
Yes. Bye.
Have a good night. Bye bye. Hi, Vale. Good evening. Thank you so much for coming earlier.
Good evening, teacher. No, it's not. Don't worry. Sorry, I don't have the camera, but my laptop doesn't have the camera. I didn't. I couldn't fix it, and
Mhm.
my phone doesn't work, so that's why I can put the Zoom in my phone.
Okay, no worries. And
But for the next class, I think I will have my phone.
yes, please, it will be
And another thing,
yes.
I have COVID.
No way.
Yes,
Wow, that's why you were feeling sick those days,
those
right?
days. Yeah, yeah. I have COVID, but
Okay,
thanks God is everything okay. And nobody in my family is with COVID, so
just you.
yeah,
Your
just me.
friend or your cousin, maybe, or no?
My cousins take the test,
Uh-huh.
make the test, but they are negative.
Okay, that's so weird,
So
but that's good.
yeah, I think it's good. Even when they told me that I was positive, I was like, I can't believe it.
So weird.
Then
Where do you think you get contagious?
I was thinking maybe on Tuesday I went to the sedes to check my
Mm,
papers, and there was a lot of people, but a lot of
yes,
people. And I think there because then I was only in my house.
yes,
So
it
I
should be.
think it's the sedes.
Yes, it must be there. Okay, but the good thing is that you're feeling better, right?
Yes, yes, yes. I'm really good.
Mhm.
So I'm only waiting the day number 10 to go and do another test to say, okay, I don't have COVID more.
Absolutely well. I think it's the best thing. Eat well,
Yeah,
take vitamins, do some exercises, and you will feel better.
yeah. Thank you, teacher. Thank you.
Okay, let's talk about our topics.
Okay.
Okay, can you explain what an X-ray is?
X-ray.
Yes.
I think it's a complement test that can help us to verify a diagnosis, or like for example, you are thinking that the person has some problem in their lungs, so you can ask an X-ray, and you can see like the patterns on the image, and then you can discard one illness from another.
Okay.
Or for example, to verify like a fracture in the ribs, for example, or to see how is the heart, the lungs, or the distant organs. I think it's a really it's uh, one of the most regular, and I think it's one of the most cheapest
Mm-hmm.
complement test to like verify a diagnosis or discard the diagnosis that you are thinking.
Okay. Okay, Vale, that was pretty complete. Um, just two things. Um, the first thing you said it was what type of procedure you said? A complementary. Okay,
Complement test, exactly.
complementary, not
Okay,
complement. Yeah,
okay, complementary test.
yes,
Okay.
that's it. And the other thing is when you talk about the cheapest, one of the cheapest treatments, it's good, just cheapest. But you cannot say more cheapest because when you say cheapest, you're just telling
Yeah,
that
yeah.
that is
More is for longest one. Yeah,
okay.
exactly. Thank you. Thank you.
Okay, no worries. But it was so good. The explanation was okay. I understood everything. And what a CT scanner does. Do you remember what is a CT scanner?
Um, I think it's like a tomography. Yeah,
Yeah, computerized tomography.
tomography.
Mhm.
Well, It's also a complementary test, but is more expensive than X-rays. But for example, if you ask an X-ray, okay, you can see some parts of the body, some organs, but with that tomography, you also can see the parts, but it gives you like a a better view, you can say, a better view of the parts, the organs, and what are like inside. For example, the X-rays, it can show you the heart, like only the structure, that it's normal, or maybe it's a little bigger, or I don't know, something like that. But with the tomography, also you can see that the heart is bigger, but you can see like inside of the heart. You can see
Okay.
the parts, like the parts. And for example, in talking about the abdomen, I don't know, maybe for the pancreas, uh, with an X-ray, also you can see like the outside, like the structure, if it's bigger or it has something, but not so exactly. But with a CT, you can see also the structure, if it's bigger, like the things outside, but also inside. Maybe it has, I don't know, an infection or something. I think the tomography gives you a better vision of what happened, like what is inside, or I think yeah, I think it's that.
Okay. That's more specific, right?
Exactly.
Uh, well, can you explain the taking blood procedure?
Taking blood. Uh, yeah. The person has to be seated. Then you have to search the vein, or like searching in which part it's better. In the most case is in the, I don't know if it's okay, in the flexure of the
Yes.
arm.
Yes, on
Uh,
the interior part of the elbow, or the on the arm, on the flexure.
in the flexure of the arm,
Mhm.
and then uh, with a band, like with an elastic band. And if you don't have an elastic band, you can use your glove.
Okay. What is the name
Your
of that elastic band?
ah
I know you know.
no, uh, eh, rim. No,
Tourniquet.
sincerely. Yeah. I was trying to say that with the elastic band, you have to do a tourniquet. So
Okay.
yeah, I wasn't sure that if you are saying tourniquet, you're talking about the elastic band. I think that when you say tourniquet, is the action
Figure.
or pressing the arm in this case.
Okay.
The,
Making a tourniquet, or using a tourniquet. In both cases, I think it's okay. But if you want to be specific, make a tourniquet with an elastic band, it's okay.
okay, thank you. Well, you have to make a tourniquet, so your the vision of the vein it's more it's clear. Then you ask the patient to make a, oh, I don't remember, make make fist, make a fist, make a fist,
Hmm?
and then you put the I don't know how to say aguja in this moment. I don't remember.
Needle.
Needle. So like push the needle in the vein and then extract like 5 mLs of blood. Then when you are when you take the blood, ask the person to um, mm, the person is making the fist, so it has to like extend the hand. I don't know how to say. Then you take out the needle
The
and
needle.
you make or take out the tourniquet. And
Okay.
also put something in the injury and press.
Okay, that's so good. Little piece of cotton with alcohol, maybe.
Cotton. Yeah, sorry, I forgot the word.
Okay, that's good. That's a good explanation. Even though you forget the name of cotton.
Yeah,
Okay,
cotton view. Sorry.
okay. Can you explain the main differences between an endoscopy and an enteroscopy?
Okay. Sincerely, I'm not sure. I'm not
Yeah.
sure, but what I understand, it like both are a complementary test to have a vision of the inside part of the digestive system,
Digestive.
digestive system. An endoscopy, it could be like introducing the tube, the machine. You can say the tube. How do you
Tube.
say the tube?
Tube.
Okay, from the mouth or from the anus of the patient. And then it depends. If you want to see like the upper part of the digestive system, you put with the you put on in the mouth, so you will see like the stomach and maybe the duodeno,
Yeah.
duoden, duodeno. And if you want to see like the low part, you go from the anus. And enteroscopy, I understand that it's something similar, but you have to put the tube from your nose, like introduce the nose, and also will go until to the stomach.
Stomach. Remember.
Stomach.
Yeah.
Sorry, stomach. But sincerely, I don't understand so well what was the difference.
Okay. In general, the main difference between these two procedures is just that one, the endoscopy. First one is that you can go by the mouth and just take 2/3 parts, if I'm not wrong, of the gastrointestinal system. Okay. And the enteroscopy can go from the mouth and pass
Student.
all your body,
Oh,
getting out to the anus.
ah, oh, okay, okay. Thank you. See, really, yesterday I was like, okay. The only thing that I saw that's the it could be like in the nose, the enteroscopy.
Yes,
But
I don't know. I don't know if it's possible, but maybe if maybe if something like, for example, the tongue is a little bit inflamed or something, and it can allow to pass the tube. So maybe the nose, it would be the best area to continue.
Option. Mm.
Yes.
Sincerely, I didn't see an enteroscopy. Truly, I didn't see it.
Me neither. But I was talking with your classmates and they were telling me some good ideas. I will take a picture. Just a second, please. Thank you so much, Vale.
No, thank you to you, teacher. See you tomorrow.
Okay, just
Take care.
one more. Please don't go. Hi, Jethro. Okay, thank you, Vale. Take care. See you tomorrow.
See you.
Bye-bye.
Bye.
Bye. Hi, Jethro. Good evening. You are muted.
Oh, sorry, teacher. I say good evening.
Oh
Thank-
yeah, I know. I could read your lips. Okay. Okay, Jethro. Let's talk about an X-ray. Can you explain to your patient what an X-ray is?
Teacher, I couldn't hear the last part. Please, can you repeat?
Yes. Can you explain to a patient what an X-ray is?
Okay. X-ray. The first one I could say to my patient is it's a medical examination or it's a medical test that is important. In this test, it's we can see the lungs, the heart, and if there are disease like I don't know how to say pneumonia, creo que it's
Pneumonia. Pneumonia.
pneumonia, and we the doctors and the medical health can see this disease with X-ray and helps a lot to the doctor to see this, for example, this condition like pneumonia, right? And it's important to say to everyone, or in this case, if a patient, if a patient is pregnant, uh, she can't do this test or this test is right, huh? Test
Procedure. It
or
will be better. Procedure. Yes.
this it can do in patients if a patient is pregnant because it's dangerous for the baby and in this condition.
Okay. And what a CT scanner does?
Oh, CT is tomography, right?
Do you remember it's a computerized tomography?
Yes. Sorry, Richard. This is procedure 2. We and more specific, and we can see all the different parts of the body. Sorry, but with more I don't know how to say it. Más detallado. I look in this word.
More specific or detailed?
Yeah, we can see the parts of the body more with more details,
Okay.
and we can see in another pathologies like exactly like pneumonia. And this time with COVID, this procedure helped us a lot to see the pneumonia for COVID for COVID. It helped
Okay.
a lot.
Okay, that's good. Can you explain now the taking blood procedure?
Okay. Okay, taking blood procedure. Okay. This is a test for would help us to see the white blood cells and red blood cells. And the first one, and the most common part of the body we can do this procedure is in the arm. And what we need, I don't know how to say in English, vena cephalica. Vena,
Cephalic vein.
yeah, vein. Okay, and we can do this procedure in this vein, or the artery is more common. Depends of the test. How, and the gasometria, how can I say gasometria in English, teacher?
I'm not sure, but I will look for, I think it's almost the same gasometry. But
Okay.
let me check. Continue.
And this type of test, we use the artery, right? In the artery. And another test, we can take the blood for the veins, and depends. But in general, we do it in the arm, and we need I don't know how to explain this. Sorry, teacher, it's easy to do, but it's very difficult, very hard to me explain this procedure.
Okay, no worries, but you have to think in English. If you're looking for the translation, you will have this problem, and you know it. So try to explain it in English.
Okay. Okay. We take the blood for this procedure in principal in the arm. Okay, and we need I don't know how to say tourniquet Liga.
Tourniquet.
Tourniquet, and I forget this word, jeringa.
Syringe. Syringe.
Syringe?
Syringe.
Okay, and this is
Repeat it after me. Syringe.
with S? Syringe?
Syringe. Syringe. Yeah.
Okay,
Syringe. You have to repeat it. I will write it down for you. Okay. Okay, continue.
I can see it. Basometry?
Yes.
Okay, and we need this and one
Translation you were looking for, right?
gasometría.
Gasometría. With G. G de gato.
Exactly.
Okay, I will look for syringe. Just let me send to you this. Syringe.
Syringe. Also,
Yes.
the main
Yes,
word.
that's
I don't know this word. Syringe. Okay, we need the syringe. I think this is more important for this procedure. Gloves for examination. We can use this, and a tourniquet too. And okay, thank you, teacher. Blood gas.
yes. Gasometría, blood gas. Okay.
We need, and the procedure depends of the patient, because one person can have I don't know this, I want to say venas delgadas, o depende del tamaño de las venas.
Thin veins or delicate veins. Thin is delgado.
Okay, we can say delicate veins, but it depends. Example for me is my veins it's bigger. It's easy to take blood, or and the patient who is so tiny and there's no bigger, it's a difficult this procedure. Or the first one, we need this take the blood and put in the, I don't know how to say in English his name. This tubo, solo tubo.
Tube?
Sí, pero
Tube?
there is a name, but I don't know the name of this tube. This is a special name. I don't know how to say. Let's put the blood in this tube.
Ample tube.
Sample tube. Okay, teacher.
Yes.
We put the blood in this,
Huh?
and I think that's all. I don't remember, but when I do my internship and the service of pediatry, and the childs and the babies, and the
Mhm.
moment of the baby's born, and we take the blood for the cordon umbilical. No, I don't know how to say it.
Umbilical cord.
Umbilical cord.
Yes, umbilical cord.
And we take the blood for this,
Mhm.
and we help us a lot to see red blood cells. And in the special cases, we need to use heparin for the blood does not be
Coagulated.
coagulated, and help us a lot for see the red blood cells and white blood cells and hemoglobin too.
Okay. Okay, Jethro, that was good. Just think in English. I know it's a little bit difficult because we are native Spanish speakers, but think in English, because if you're making the translation, you will make so many mistakes, okay? Like, for example, when you say thin veins, in Spanish is venas delgadas. But you know, if you translate, you will say veins thin, for example. That's a common mistake. Changing the words when you're translating, okay? Besides, if you think in English, you will make a good conversation. You will make yourself understand. It will be better. Okay, just one more picture, please. Okay, Jethro, thank you so much. Have a great night and see you tomorrow, okay?
Okay, teacher, thank you for helping me when this works. And
I
have a
know,
good.
but that was good. You have a good conversation, so I think you can do much better. Okay?
Okay, teacher, thank you. Okay, have
Take
a good.
care.
Bye.
You too. Bye-bye. Good evening, Jorge.
Hello, good evening. How are you?
I'm fine, thank you. How are you?
Pretty good, thank you.
Okay, Jorge. Um, let's talk about some topics from yesterday.
Okay.
About that, I have a question here, specifically for you.
Yes.
Can you explain to me the main differences between endoscopy and enteroscopy, please?
Oh, sure. Okay. I think that endoscopy, I'm not really into both kinds of examinations, but I think the difference is that endoscopy must be done like I think it's easier to make some less like a more common procedure, and then enteroscopy is like more focused on like the final tract of the bowels. Instead of that, endoscopy is like it looks from the beginning, from I mean from just starting from the esophagus, going through whatever it is like intended to go. So I would say that that might be the main difference, but I'm not really sure. I'm not really into it. I gotta be sincere, and I'm not really sure about it.
Okay, but that's good. I was asking the same old questions, and yes, I think you agree with them. So I was thinking the same question. I'm
Okay.
not sure about that, but yes, it's the main difference. Okay. In which cases would you recommend it, or endoscopy or enteroscopy?
Well, whenever you doubt about maybe something that is really common is, for example, gastric reflux,
Mhm.
because you have to see, for example, you ask for endoscopy when you have to see the esophagus sphincter. You have to check its integrity, and that's a must when there is, for example, gastric reflux that does not fix with medical treatment. I mean, with drugs, omeprazole, ranitidine, and that stuff. And you must check about sphincter integrity. Also, whenever you doubt about cancer or any kind of obstruction, you may not see with I don't know, with an echography or with an X-ray that is not like well, like really specific with those image studies. So
Mhm.
yeah, I would say basically for that, yeah, or maybe also when there is um, for example, blood in the pieces, or blood when vomiting. Um, Also, you have to check if it's an hemorrhage from where, you know. It's really important to know that if it's constant.
Okay. Okay, perfect. Um, Changing to another topic, can you explain the taking blood procedure?
Excuse me, can you repeat it? The which procedure?
The taking blood procedure.
Oh, you mean taking out blood from a vein?
Yes.
Okay, perfect. Sorry, I didn't understand very well. Um, okay, first, you have to clean the area. You're gonna take out blood. You're gonna check. It's really important to check which vein you're gonna puncture first. You have to be sure which is the best for you. It doesn't matter. For example, in my opinion, it doesn't matter if it's a thick vein or maybe a thin vein, but you gotta check which is more comfortable for you, doing the trajectory of the needle and that stuff. So after you check the vein, I mean you palpate over the vein, over the skin, and check if you agree with that. And after that, of course, you clean the place with alcohol, and uh, you have to how do we call it? I forgot the name. I know we said it yesterday. It was to press this kind of rubber rubber material
Fist?
to yeah
I know.
to
Yes, the fist? No, you
no
mean
no no no
the
no
band?
not a fist. Yeah, the band, exactly, the band to
Sneaker?
make pressure with the rubber band to make pressure over the arm. After that, you ask the patient to make a fist,
Mhm.
and that causes the veins dilation. So after that, you do the puncture. Never forget the grade of inclination of the needle. That's real important too. So you can follow the vein path, not
Mhm.
so deep, not even too like superficial. And when you have like the blood showing up in the needle, you take out the rubber band. You ask the patient to extend his or her fingers to leave the fist, release the fist, and then you take the the blood that you I don't know the quantity you need. After that, you put a gauze on it, and that's it.
Okay, very specific. That's so good.
Thank you.
Thank you. And on the other hand, imagine you have a patient and you have to explain to them what is an X-ray.
Okay, so I would say an X-ray um, is diagnosis test, an image diagnosis test that is important to see what we cannot see superficially. So we need to make like a deeper image with a specific device, in this case the X-ray machine, and take a picture. Maybe I would explain a patient who doesn't know how it works. Take a picture of with a I don't know with a fast shot, like a flash shot, and see what's inside. Um, yeah, regarding bone stuff, sometimes pulmonary stuff, cardiac stuff also is sometimes important for X-ray. Yeah, I would say that would be a brief explanation
Mhm.
of what how an X-ray works or
Okay,
X-ray
perfect.
machine works. Thank you.
Yes, and on the other hand, we have the CT scanner. How it works or what, yes, how it works.
Okay, so CT scan is like I would say it's like a different image testing, something more complicated because the patient must be lay on a machine, like I don't know how to it's like a big circle with like a kind of bed that a patient has to lay on, and the patient must not move. It's going to take uh, um, a lot of pictures, a lot of slides, a lot of cuts, um, also like a photograph, but a lot of cuts of different levels of what we were asking for. For example, head CT scan, skull CT scan is going to take a lot of different levels that we were asking for. And it's really important also. I think it's one of the most important um, required tests for the patients when we doubt about a lot of things.
Perfect. It is always used contrast or it's
Not
not?
always, not always. Use contrast when you have to see any vascular issue. Only with vascular issue, or maybe also cancer. I mean tumors.
Mhm.
Regarding I don't know, any kind of tumor must be you need to see the you need to use contrast so you can watch all the vessels surrounding the tumor, vascular and tumoral stuff.
Okay, that's good. And the last question, since we mentioned all of these procedures, maybe you can pick one and describe the whole procedure.
Okay, so maybe a CT scan procedure. head CT scan. So I would say that ask the patient to. I never been into this, but I saw it a couple times, and I would ask the patient also maybe with contrast. The contrast is something interesting about a contrast is that when they put a contrast in your bloodstream, I heard a lot of patients feel that they pass water because
Yeah.
the contrast, yeah, it's really really, I don't know how to say it, like really thick, and the patients feel like they pass water. My nephew just had this kind of examination a couple months ago, and he was really scared because he didn't know that. I forgot to explain him that. And the contrast also is not that harmful, let's say.
Mhm.
Of course, you need to we need to know the patient's creatinine levels due to renal failure and renal clearance, because all the contrast is eliminated um, from eliminated through the renal system.
Okay.
So yeah, the patient, besides that, the patient must not move. He or she has to stand, he has to lay down. um, I think one of the most important things is that he or she does not have to move. It's like it doesn't take too much time. I think 10 minutes are enough, so they can see all the cuts if they're really smooth or not. And yeah, I think that would be
The
almost
whole procedure.
everything.
Yes, I think it was pretty much complete. Thank you, Jorge. Thank
No,
you so
thank
much.
you.
And of course, I will send it to you, my questionnaire.
Okay,
Please
perfect.
fill it for me. And I will take a picture.
Okay,
Okay. It is always nice talking to you, Jorge.
thank you so much. Thank you so much. I think the same with you.
Okay, thank you. And you solved some doubts I have about medicine things.
Oh, no
So,
problem. Whenever you want to ask me, if I don't know, I'm going to be sincere and I'm going to tell you. I'm not really sure, but I will tell you what I know.
okay, that's good to know. Thank you. Thank you so much. Have a great night. See you tomorrow at
See you
8
tomorrow.
o'clock.
Goodbye. Thank you.
Bye-bye. Thank you. Hi, Rina. Good evening.
Good evening, teacher. How are you?
I'm fine. Can you listen to me very well?
Yes, teacher. Now I have a problem.
Oh, what?
I can hear you.
Oh, no. To me? I can listen to you, but I think it's, oh no, there is no more people talking around you. Okay,
No.
I think we
Okay.
can make it.
Okay. Teacher, I can hear you. What happened?
I will do.
No.
Okay. Listen to me now.
Yes, but I can hear you a little space. I can hear you continue.
Oh, okay. Maybe the signal. I don't know. I'm so sorry about that. Or with a little delay.
Yes, it's probably.
Okay. We can lead with that or deal with that. Okay. Okay. Let's go. Can you explain to a patient what an X-ray is?
About what, teacher? I'm sorry.
About, can you explain to your patient an X-ray? What is it?
Okay, I hear you. I hear you with a little space, and the second time I completed the idea.
Okay, I'm so sorry.
Okay. I need to explain the patient when for example, I have to send some patient an X-ray. I have to explain the situation. For example, an X-ray in the of a leg, for example, I have to tell him or tell the patient the X-ray is a part of the test that is indispensable for determining the health state and determine some diagnosis. For example, a trauma or a fracture, or if some lesion on the bones. The second, I have to explain that the X-ray is that kind of radiation, and it is very indispensable that the person doesn't use in that moment to the take of the X-ray some jewelry or some metal in the, for example, the bell, earrings, or something like that, because it's very makes a problem with the X-ray, with the image, and it's not recommended for the radiation. The second, I have to tell her that the X-ray for the test or for the procedure, the patient have to move and have different explanation. And the last one, because the person or the specialist who takes the X-ray use a specialist suit, so the patient probably think the X-ray is bad and dangerous, and probably doesn't want to take it. And I need explain that the X-ray it's needed, it's a priority, and it's for an urgency situation, and there is not a problem for a take once in the location. Yeah, and the person who take it use that suit, it's because that patient exposed to the X-ray all the time. Probably the patient don't, probably the patient don't have anxious with that part of the about the X-ray.
Explanation. That's a good thing. Just a few things. Maybe when you pronounce or you talk about dually, okay? Talk about earrings or rings, dually.
Dually.
Dually. And the other thing, it's procedure.
Procedure.
Yes, that's right. Okay, but that's good. You make yourself understand. It's just a few things that we have to solve with the pronunciation, okay? And maybe you were talking about suit made for, that is plomo.
About plomo lead.
Yes.
Yes.
So you can say a suit that is made for of lead, for example.
Okay. I can use the word lead for that explain the kind of special suit that the kind of person use for protection. Yes.
Yes, of course.
Okay.
Okay, to make it more specific. Okay, even more specific. Since you like to explain so well, as I like to listen what you're saying. Okay, I'm so happy. I would be so happy and glad to be your patient because you explain the things more the best way you can, and it's so specific, and you make yourself understand. So that's pretty good.
Thank you.
Another thing, can you explain the taking blood procedure?
Yes. Well, the take blood, it's the different steps that the procedure. It's easy, but you have to understand the anatomy and yeah, precisely the anatomy. When the specialists take or make a take blood, generally take the one vein because the most of the test blood include hemogram, levels of the bilirubin, levels of the immunity cells, creatinine, sodium, potassium, chlorine. Yes, and the test of a specialist about the liver functions. So for that reason, they take a vein. When the test blood, it's very, very specific. For example, when it's indispensable to take or review the level of the CO2, I don't know, dioxide of carbon, or the level of the oxygen.
Carbon dioxide.
Carbon dioxide. Okay. Carbon dioxide, the level of the oxygen is indispensable to take the blood from the artery. But in another way, on the normal situation, it's in a vein. The typical problem when you take the test blood is the condition of the vein of the patient, the anxious of the situation, that the patient, for example, the patient having a scare of the needles, or the age of the patient. It's for that reason. If you take, or if you want to take in a vein and you made a mistake or dose of the vein, it's a little difficult to ubicate, you probably produce in a trauma in a vein. So that part, the vein, it's impossible to take again or try to take the blood again. So the order we do with the specialist take the vein. It's first it's the vein, the radial vein. That is the level of the wrist. And after that, in another way, it's about the veins, about the region of the back of your hands. That's way. And that you cannot have look to see the vein. You start to ascender.
Yeah.
According with the anatomy of the veins. And the last one is the vein poplitea. It's a vein in the level of the de la fosa del, yeah, fosa poplitea. Yeah, I'm sorry, I forgot the name. Is the part of the vein when typically the person who donor blood that is take. I don't know, the in the middle of the arm. Yeah.
Okay, the flexure of the arm.
Yes, the flexure of the arm. Thank you. And that is the steps. When you take the blood, the test blood indicates, for example, it's useful for the study of the level of the iron. If the normal results, we can find some pathology from the blood, for example, anemia.
Mm-hmm. Yes.
Probably is the
Anemia.
Anemia. Okay, anemia. The different kinds of anemia or leukemia. We have a suspicious about leukemia, anemia. The problem about
Leukemia.
the leukemia. Yes, leukemia. The problem about the plaquettes. Problem of the bleeding.
Platelets.
Platelets. I'm sorry.
Platelets.
Platelets, and you can have a problem with the level and produce bleeding or a problem with the coagulation. That is the hemogram. The another part, the test blood. We can study the correct function of the liver. The correct function about the liver, like the organ, and the precisely function specific of the liver, for example, the producer of the bilirubin. What else? Another, we can find some, we can find even though infections, but that is in a test blood very, very specific. The normal test blood, it's a hemogram, the liver function, the problem with the coagulation. The function of the kidney for the creatinine, the level of the sodium, potassium, calcium, chlorine, for the problem of the electrolyte. I think generally like that.
Okay. Okay, perfect. That's a good explanation. As I always told you, you're so specific. So that's a good explanation of the procedure. Well, there is another question. What is the main difference between endoscopy and enteroscopy?
Okay.
I'm so sorry, Rina. I didn't. Hi, Ale. Just hold on, please. We could talk the whole night.
Yes, the time is too short.
I'm so sorry.
That's okay.
We will have another question for the next class, okay?
Okay, teacher.
No, thank you so much. Just one picture and one more, please, and I'll let you go. Okay. Okay, now what is going on? I'm so sorry. I have. Okay. Now,
Okay.
thank you so much.
Thank
see
you, teacher.
Take care.
Okay. Bye, teacher.
Hi, Ale. Good evening.
Good evening, teacher.
How are you?
Good. Thank you.
Okay, that's so good to know. Ale, could you explain the taking blood procedure?
Yes. For taking the Persian blood, the patient have to stay relaxed and calm for 5 minutes. Then we can put the cuff in the left arm. We close the valve and insufflate with the pump around 180. Depends the patient if have hypertension or not.
Okay. But thank you, Ale. I'm so sorry to cut you down. The taking blood procedure is the one that we were talking about yesterday with the needles and the tourniquet to take a sample of blood for the laboratory. Yeah, please.
Okay. We need alcohol, cotton for disinfect the area first. Then we can put a tourniquet. Then later we can take the blood with no sé cómo decir esto, pero ahí se me fue, la punta de la jeringa tiene un nombre.
The needle?
I don't know.
Needle, aguja?
Yes, but have angle, have a special part.
Okay.
That part.
You can say the active part of the syringe, maybe. La parte activa de la jeringa. It works for you?
Yes. Can you repeat me one more time, please?
Yes, the active part of the syringe.
Syringe?
Syringe, jeringa.
Okay.
I will.
The active part of the syringe and that part enter.
Syringe. I will send it to you so
syringe.
you can. Syringe.
Okay. That part enter or break the skin.
Okay.
If we don't use that part, maybe we can produce a lesion or injury skin, like hematoma.
Yes, hematoma.
Or ecchymosis. Extract then we can extract the blood around 3 or 5 milliliters.
Yes.
That's
Needle.
all.
Maybe the word you were looking for is needle tip.
Maybe yes.
Punta de la aguja.
Yes.
Or what
But
is the
have a
name?
specific name that I forget.
Cell?
Mm,
Bisel.
yes.
Bisel de la aguja. Right?
Yes.
Okay, let me check. Continue.
That's all for taking blood.
Okay, so let me check. It might be needle bevel. Needle bevel.
Okay. Needle
Bisel de la aguja. Needle bevel.
Okay.
And needle tip, la punta de la aguja.
Sorry.
Oh, bless you.
Thank you.
Okay. Okay, that's good. And another thing. Can you tell me what are the differences, the main differences between endoscopy and an enteroscopy?
Yes. The enteroscopy is specific for the digestive tract. For example, we can have a patient with blood with vomit with blood, and for the diagnostic, we can do the enteroscopy, and we can see the esophagus and the duodenus and the stomach. We can see the lesion. Sometimes the most common is the gastric source or peptic source. And other reason maybe the lesions of the vasos.
Lesions.
Of the esophagus.
Okay.
And the other is, the difference to the endoscopy is the endoscopy is for other organs or other parts. For example,
endoscopy. The enteroscopy?
No, the endoscopy.
Endoscopy. Okay. Okay. Go ahead.
Like I don't know, maybe in some cases of pancreatitis for obstruction. Sometimes the calculus of the gallbladder can pass to the hepatic or pancreatic duct, and we have obstruction of the pass. In that cases, we can release the duct, and the name of one cholangiopancreatography.
Yeah.
Okay. And other difference is the enteroscopy is more for diagnostic, and the endoscopy for diagnostic and treatment.
Okay. Okay, thank you so much. Could you describe one of these procedures, please?
Okay. For maybe the enteroscopy, for this, the patient decide if he or she want anesthesia or not, and swallow. If don't want anesthesia, the patient swallow the special camera of the endoscopy.
and we can see all the digestive tract, the the esophagus, the stomach, and the duodenum. If we don't see lesions or we see lesions, we can take pictures
Mhm.
of all this tract.
Okay.
We can see some specific lesions for I don't know, maybe gastric sores or neoplasms, or lesions or injuries of the stomach for bacteria like Helicobacter pylori.
Yeah.
And for finish, we can retiramos.
Okay. What do you want to say? What is the whole sentence?
Retiramos la cámara, el
We
endoscopio.
we can remove
Yeah,
or
yes. Yes, we remove the and the camera or the enteroscopy. That's
okay.
all.
Okay, Ale, that's good. I really enjoy your conversation today because you have a lot of new vocabulary. You were using some technical terms in a good way, in a correct way. So I really like this conversation. Congratulations.
Good teacher.
Okay.
I can't fold the questionnaire. I don't know why.
Maybe if I send it again. Now, can you see it?
I can see, but okay. Okay.
Okay, now
It's done.
you could. I will just take a picture, please.
Okay.
And I don't know. Oh. And just one more. And I'll let you go. Yes. Thank you so much, Ale. Have a great night and see you tomorrow, okay?
See you tomorrow, teacher. Have a good night too.
Bye-bye. Good evening, Weimar.
Good evening, teacher.
How are you? You are a little bit late, but we still have a few minutes, okay?
Teacher.
Okay. Weimar, can you explain the taking blood procedure, please?
Teacher, no lo escuché bien.
Can you explain the taking blood procedure, please?
Okay, teacher. Um, most of the time the blood is extract from being located on the inside, on the elbow or the back of the hand. The site is cleaned with a disinfectant and antiseptic. An elastic band is placed around the upper arm in order to apply pressure to the area. This causes the vein below to fill with blood. A needle is inserted into the vein. The blood is collected in an airtight vial or tube attached to the needle. The elastic band is removed from the arm. The needle is removed and the site is covered with bandages to stop the bleeding. Sent to the lab for analysis.
Okay. What type of antiseptic do we usually use to disinfect or to de-infect?
Ok, teacher, ¿qué tipo de antiséptico? Usualmente we use chlorhexidine and povidona ayudado, teacher, ¿cómo se dice?
Okay, but when we de-infect the area where we will make this taking blood procedure, we only use alcohol, right? Or am I wrong?
¿Qué enfermedades, teacher? O no lo entendí muy bien. ¿Usamos
No.
alcohol?
Te digo, para hacer este procedimiento de sacar sangre, nosotros generalmente utilizamos alcohol, ¿verdad? Nada más. O en tu experiencia utilizan clorhexidina y yodopovidona. Generalmente.
Clorhexidina y alcohol, teacher.
Ya. Es que yo solamente vi que usaban alcohol, nada más. Pero si tú tienes experiencia con ese otro desinfectante o antiséptico, está bien. Ok. Can you explain the main difference between endoscopy and enteroscopy?
Okay, teacher. Endoscopy, bueno, y enteroscopy, ¿no, teacher? Bueno. Enteroscopy, it is a procedure used to exam. Teacher, la pronunciación de exam, examen, o examen.
What do you want to say? ¿Qué quieres decir?
Bueno, en la endoscopía, bueno, el procedimiento que se realiza, eso, más o
On the
menos, examen.
Okay. On the procedure, es que necesitas traducir una oración, no palabra por palabra. Te dije, ¿verdad? A veces no se coloca en el mismo lugar que en español. Por eso no se traduce palabra por palabra. Si tú me dices una oración, yo te ayudo a traducir para que puedas entenderme mejor.
It is procedure used to examine
Examine.
The small intestine.
Okay.
Enteroscopy. Duodenum, jejunum, ileum.
Okay. Okay.
Adding flexible top endoscope is inserted through the mouth and anus.
Okay.
Voy
a mandar mi cuadro.
Endoscopy, anus colonoscopy. Okay, teacher. Yes.
Okay, can you fill it for me, please, Weimar? Weimar, tengo este pequeño detalle. Me preocupa mucho el hecho de que, bueno, las primeras clases está bien, ¿no? Para tener ayuda de memoria, todo está bien. El problema es que estás memorizando, si es que no estás leyendo. Y cuando te pregunto otra cosa, no te puedes explicar. Entonces, es difícil, es complicado para mí evaluarte así. En lo posible, trata por favor de aprenderte las lecciones. Yo sé que es mucha información de una sola, pero tú ya sabes, es medicina. Tú ya sabes estas cosas. Simplemente tratar de que el inglés abarque la mayor parte, ¿no es cierto? Habíamos dicho con pronunciación. Te voy a mandar otras de TikTok que he visto y que te pueden servir también. La pronunciación ha mejorado, claramente. Hasta cuando lees estás pronunciando mejor. Pero yo necesito que te puedas explicar y expresar en inglés. ¿Ya? No solo leer. Ujú. Okay, it's really important that you can express yourself in a correct way in English. Okay, I will take a picture, please. One more, and that's all for today. If you don't understand anything, you can ask on theoretical class, okay?
Okay, teacher.
As well as your classmates do, you can do it, okay?
Okay, teacher.
Okay, thank you so much, Weimar.
Thank you,
and
teacher.
see you tomorrow, okay? Take
Okay,
care,
teacher.
have a great
Goodbye.
night.
Goodbye, teacher.
Bye-bye. Hi, Jocelyn. Good evening.
Hi, teacher. Good evening.
Good evening. Can you turn on your camera, please?
Okay, teacher.
Thank you so much. Jocelyn, can you tell me the main difference between an endoscopy and an enteroscopy?
Okay, teacher. An endoscopy is pressure where a long, flexible tube inserted to mature orifice to examine parts of the body that are not visible from the outside. For example, mouth and anus.
Okay, that was the enteroscopy?
And yes.
Okay.
And enteroscopy. Enteroscopy is pressure used to examine
Examine.
Yes, examine the small intestine, ¿cómo se dice, teacher? Duodeno.
Duodeno.
Solo duodeno.
Yes.
Duodeno, yeyuno e ilium. A thin flexible tube endoscopy is inserted through in the mouth and anus.
What is the last word?
What's, teacher?
¿Qué es la última palabra?
Anus.
No he entendido la última parte. Okay.
Que se inserta un tubo flexible, decir, ya sea por orificio, ya sea por la boca o por el ano.
Anus.
Anus.
Anus is the correct pronunciation.
Anus.
Okay. Okay. Can you describe the taking blood procedure?
Okay, teacher. Also called phlebotomy and venipuncture. Venipuncture is a pressure where blood is drawn. A needle is inserted into the vein. The blood is collected is sent to the laboratory for analysis.
Okay. To analyze or for analysis?
Analysis. Yes.
Okay.
La A se pronuncia como E, ¿no, teacher?
La A es como A.
¿no?
A, pero en algunos casos sí se pronuncia como A. Hay que saber distinguirlos, pero generalmente es A. Okay, and in this case is analysis. Como AE, ¿no? Analysis.
Okay.
Jocelyn, para lo mismo, para mejorar, necesito que necesito que puedas tratar de leer para mejorar la pronunciación, ¿ok? Tienes que mejorar la pronunciación porque si no, aparte que no estás pudiendo responderme por ti sola, porque sé que estás leyendo, la pronunciación es muy importante, no te dejes encender, ¿ya? Entonces, para que sea un rebote, digamos, de palabras, para que sea una conversación fluida, necesitas hacerte entender. Así que leyendo en voz alta, puedes escuchar canciones y luego leerlas en voz alta o cantarlas, lo que sea, te va a servir para pronunciar mejor. Sin vergüenza que tienes que pronunciar como C, o sea, TH, ¿no es cierto? Eso, como mordiendo la lengua, o sea, tienes que hacerlo. La B chica cuando pronunciamos es de V, ¿ok? Vessels, ¿ok? So, I need you to practice more, please. Ok, vamos con la última pregunta. What is an X-ray?
X-ray?
Yes, X-ray procedure. Can you explain to me?
Okay, teacher. Yeah. The X-ray is a quid in the pilot detects to observe intestinal structures of the body.
Internal structures of the body.
Yes, teacher.
Repeat after me. Repetir después de mí, no tengas problema. Internal structure of the body.
Internal structure, eso no puedes.
Puedes, es solo educar la lengua. Al principio es como un trabalenguas para nosotros porque es un nuevo idioma, pero después de que aprendas, créeme, la lengua se va a acostumbrar. Structure of the body.
Structure of the body.
No es con X. Structure.
Extraction.
No, sin X. No extracture. Fracture. Sin la X. Structure.
Extraction.
Sin X.
¿Cómo es?
Structure.
Structure.
Tienes que tratar de, por eso te digo, tienes que tratar de leer. Tu cerebro tiene que estar viendo, tú tienes que estar pronunciando y al mismo tiempo escuchando. Por eso una canción con letra va a ser ideal. O algún cuento con audio puede ser ideal también. ¿Ya?
Es un poquito, la pronunciación es muy complicadita.
Al principio, pero se supone que ya sabes inglés. Para llegar al módulo de inglés médico ya deberías saber salir, ¿cierto? Entonces, ahorita tienes que reforzar porque medicina sabes. Si yo te pregunto en español, en castellano tú me respondes, ¿verdad? Pero este curso se llama inglés médico, por lo cual les estoy molestando tanto. Necesito que me digan en inglés. Y cuando lees, yo me doy cuenta. Cuando te pregunto otra cosa, no me puedes responder. Ese es el problema. Eso me preocupa mucho. Entonces, por favor, porque solo faltan un par de semanas. Yo sé que pueden dar un buen examen y todo, pero no sería correcto si les hago aprobar la materia sin poder expresarse ni pensar en inglés, ¿verdad? Entonces necesito que un poquito más,
¿Ya? Yo sé que están con la predisposición, por eso le están dando tiempo también para hacer sus ayudas memoria y todo eso, ¿verdad? Un poquito más de presión. ¿Ya, Jocelyn?
Okay, teacher.
Yo confío en que ustedes van a poder hacerlo, pero es muy contra el tiempo de la noche a la mañana. Así que hagamos lo que podamos, ¿ok?
Sí.
Thank you so much, Jocelyn. Le decía a Weimar que les voy a pasar, vi otros TikToks para que vayan escuchando sobre pronunciación también. Y algo de vocabulario, ¿ok? Les voy a
Okay.
pasar para que lo vayan revisando, porque a veces pasamos más tiempo en esa plataforma, ¿no? Tratando de ver una y otra cosa, entonces mejor aprendiendo también. ¿Ok?
Okay, teacher. Thank you.
Muy bien. Thank you, Jocelyn. Have a great night and see you tomorrow. Si tienes alguna pregunta, no dudes en hacerla en la clase teórica. Si no la sé yo, vamos a resolverla entre todos, pero esa es la forma, participando. ¿Ok?
Okay.
Ok.
Thank you. Goodbye, teacher.
Goodbye. Hi, Carla. Good
Good
evening. How are you? Everything is good?
Yes, thank you. Thanks
Okay.
for change my schedule.
Okay, no problem. But next time, please tell me with more anticipation. I will
Okay.
do whatever I can to help you out, okay?
Okay, thank you, Miss. Sorry for
No problem. Your classmates are so good, and she doesn't have any trouble to change the schedule.
thank you, Miss.
Okay. Well, can you explain to me, please, what an X-ray is?
X-rays. Okay, it's a procedure in which Sorry?
Procedure.
Okay, procedure in which we can obtain image of some part of the body to help us to do a diagnostic. We have to which is the word? I don't remember. We have to expose a part of the body, the body in with radiation, but this radiation is radiation. Sorry, it's in a small dose, so it doesn't have to do too much damage if it's only for a few times. Is that correct? So it can help us to do some diagnostics, like maybe broken bones would be.
Yeah.
Another will be diagnostics or sickness of lungs, like pneumonias, or another X-rays can do in different views. Is that correct? We can use in frontal. I don't know how to say it in English because in Spanish is radiografía anteroposterior AP.
Okay, you can say anteroposterior radiography or X-ray.
Okay, anterior posterior radiography. This is in the case of chest. This is most common. AP is to see bones, and PA is posterior anterior, posterior anterior. Is that correct?
Yes, it should be posterior anterior.
Okay, thank you. Posterior anterior is more to see lungs in the case of chest. And it depends what is the reason that the patient goes to the doctor. I think that, I don't know how.
Okay, that's so good. And Carlita, what a CT scanner does? Do you remember? CT scanner is a computerized tomography.
Okay. Tomography. Okay.
Yeah.
Well, it helps. I think it's most. I don't know how to say in English. I'm sorry. Estoy pasando clase. Estoy pasando clase. Sorry, miss. Okay. We can use this to have image also, but it's a scanner to in which we put the patient in a machine that it rotates, and
yes, it's okay.
Yeah, and we can have also image, but it's most common to see. We can diagnose some disease like, or maybe tumors, or maybe cancer. We can also see the el manejo, we can also the management or management or monitorizar.
Monitorize.
Okay, sorry, thank you. Monitorize the the management of treatment of cancer will be.
Okay.
I think that, and it's not common to ask for this test will be to different sickness. It's just when we have to ask for this because it's too expensive if we do in a particular case.
Okay. I think I lately, as a dentist, I heard that we also ask for this CT scanner to our patients in order to make implants. I think it's because you said that it's by slices that you can see the parts of the organ or tissue you're looking for, right?
Yes.
Okay, that's so good. Tell me.
I don't know how. I think that in the case of odontologists, I'm not sure is it the same, if it is the same, but la panorámica, is that correct?
Yes. Panoramic X-ray is one. We have the other one. Well, it's just on the on the teeth, on the tooth. I don't remember the name, the specific name right now, but the other one is the panoramic one.
Okay, another is just the teeth. Is that right?
Tooth.
Not
Yes.
tooth, sorry.
Yes, I don't remember. Oh, periapical.
Yes, that's correct.
Yeah.
Thank you.
Okay, thank you. Well, did you already explain to me the taking blood procedure? No, right? Okay, can you do it, please?
Okay, we can take blood from arteries or veins. The most common are veins. So it's called the venipuncture.
Yes, that's
so we have to use tourniquet. Tourniquet above the area or the zone that we are going to extract the blood. So we have to put the tourniquet, and after that, obviously we clean the zone or disinfect this. Sorry, Miss, I have a question in this. Is that we can, in Spanish, we use the término antisepsia, asepsia, antisepsia, but that is different to disinfection. So
yes,
we
can use the infection and antiseptic.
Antiseptic.
Yes.
Okay, thank you. So we do antiseptic in the area or some that we are going to extract the blood.
Sorry, you can say we use an antiseptic to clean the area, maybe.
Okay, thank you. We use an antiseptic to clean the area. And after that, with the needle, we punch with the needle in the vein, and we have to remove the blood and put it in a tube. But to remove the tourniquet, we remove the tourniquet before we
take out the needle.
Yeah, take out the needle. So after that, we have to, I don't know how to say it, apretar. To
make pressure?
Yes, to make pressure in the zone to evit hemorrhagia. I don't remember how.
To avoid.
Avoid, yes, and hemorrhagia.
The hemorrhage.
Yeah, right. I think that I remember the term. I don't clinch the clinch. Yesterday,
Clinch.
which yes, clinch the clinch you to be to do a piece. I don't remember how.
Yes, clinch the fist.
Oh,
Fist,
okay.
remember?
Yes.
Yes.
That is for seeing better the vein.
Yes.
Mhm.
Okay. Okay, Carlita, that's good. It was good. Just little things that comes and goes through your mind, right?
Yes.
But I think it's good. You make yourself understand. It's just you have to order your ideas a little bit, and then the pronunciation that we will working on that. Okay.
Thank you.
As I told your other classmates, maybe music can help, or
Yeah.
reading some articles in English, for example, that is on your interests. You can find some articles, maybe if it's with audio, it will be better. Okay, so you can listen, you can speak as well. You are watching how is it right. Okay.
Okay, thank you, Miss.
Okay, no worries. And I will send to you my questionnaire, please. Let me know if you can see it and fill it for me, as I will take a picture. Just one more. Okay, and that's good. Thank you, Carlita. Let me know if the next time you will have trouble get into the meeting earlier. Okay, so we can make a change with your classmates, or find another solution.
Okay, thank you, Miss.
Okay, see you tomorrow at 8 o'clock.
Okay, thank you.
Take care. Have a great night. Bye-bye.
You too.